All right. So again, yeah, I'm the owner of Table Rock Mobile Medicine. Some of you may know me, some of you may not. So let's talk about how to increase access to healthcare, and then at the end, I have some things that I kind of want to talk about that you can do in your home and beyond. So disclosures: I'm the owner of Table Rock. I have no financial gain from this. Next slide. So let's first break down the barriers, or talk about the barriers to healthcare, and kind of define what those are. So next slide. So the first big barrier to healthcare access is cost. Obviously, if the person cannot afford care, they're going to be ending up in our emergency rooms. So if they can't access primary care, I always say hospitalizations are the failure of primary care, meaning it's not the primary care provider's failure; it's the failure that the person or the facility wasn't able to prevent the thing that caused them to be hospitalized. And a lot of times it goes back to cost. Next slide. So under cost, there are kind of three main categories. Um, if your insurance isn't accepted, but you get hospitalized in a place that doesn't accept it, that could be a barrier. Are your providers in network? Will the service be covered? I've actually had a procedure done and then come to find out it wasn't covered by my insurance, so I kind of had to fit the bill for it. Does it need to be prior authorized? Sometimes I'll have a patient that needs like an imaging study, and it can be what I feel like is an urgent issue, but then it takes, days to weeks to get that prior authorized. For our self-pay patients, they want to know what the self-pay rate is for X. They want to know exactly what they're going to get charged for a visit, and sometimes it's not easy to quote that patient over the phone. So sometimes they'll not access care if they don't have a set number. They will commonly ask about discounts. They'll try to find the cheapest provider or imaging place. There's a lot of barriers to how people can pay. Some places won't accept all forms of payment. There's some free clinics in town. There's some grants and facilities that have grants to help offset the cost. And then how do people pay for medications? Because if they go to a visit and they can't pay for the prescription medication that they get afterwards, then what was the point? And then because there's big barriers of accessing healthcare, sometimes people have to travel outside the United States. I've seen people recently, in the last year, that's actually had things like a bariatric surgery in Mexico, and then when they get home, they have a poor outcome. So that's all the result of cost issues here. Okay, next slide. Did it go to the next?
It did. I'm showing distance and transportation.
Oh, don't see that, but okay. So with distance and transportation barriers, rural Idaho experiences this a lot. I'm actually from Troy, Idaho, which is up by Moscow. So we would drive almost an hour to see a movie, and an emergency room was about 45 minutes away. And if you happen to get a paramedic out there, it was actually more likely to be your neighbor who's a farmer. So that's kind of a big barrier. People with disabilities find it really challenging to get into their primary care providers, urgent cares, and ERs without the aid of an ambulance or transportation company. And then sometimes with logistics. So say you're a mom of 4 kids trying to get in to a clinic for, say, your annual wellness visit. Well, that's almost impossible. Next slide.
Time.
So time being a barrier, I think guys are pretty poor in accessing care just because they they find it difficult. They always tell me that they don't have enough time in their day to go into a clinic for their annual wellness screenings, and and parents tell me this as well. How do they fit in a visit to a clinic when they have everything else that they have to do for their routine days? Next slide.
Intentional by
So there's actually barriers that institutions put up on purpose. So if you work for an institution that does this, then try to see if you can actually decrease these barriers for your patients. So examples of this could be your institution doesn't accept certain insurances, being that be Medicare, Medicaid, TRICARE, or what have you. We do that for various reasons. Maybe it's the payer doesn't pay very well, or maybe they're challenging to be a member of, but that's a big one. Some institutions purposely don't accept new patients. Maybe they're full, and so they want to keep availability slots for their existing patients, but something to always be reevaluating. And then Table Rock actually does this. We don't see people under the age of 6 months old. We don't see people in assisted living facilities because our malpractice prevents us from doing it. And then we don't go to places that are maybe more challenging and more rural, like Caldwell, Middleton, or Caldwell, Marsing, and Wilder, and beyond. So there's mental barriers to accessing healthcare. So there's a ton of, especially right now, it's kind of been exacerbated by the pandemic, fear and anxiety, of the clinics, of various procedures, of even getting results. So sometimes people don't go in and get seen for an issue that they're having because they don't want to know what the result is. So if it's out of sight, it's out of mind. If you don't have the diagnosis of cancer, you don't have cancer, kind of thing. People have a ton of fear, especially right now, of nosocomial infections. So if you go into a clinic and you want to go in for an ear infection, but you don't want to be exposed to things like flu or COVID, well, that's kind of challenging right now because the majority of people that are going into some of these walk-in clinics are there because they don't feel well. And so it's like you go in for an ear infection or strep throat and you leave with COVID. There's a fear of penalty, meaning getting diagnosed with something that's going to be taxed on you later, like a pre-existing condition. So again, if you don't get diagnosed with it, you can't have that pre-existing condition that could disqualify you later on for a job or insurance. And then guys, myself included, have this next one, which is lack of motivation or procrastination. So we will put it off until there's, something's fallen off. Guys typically only go into access healthcare if there's problems with one of three things, and it's sex, work, or sleep. If it doesn't affect one of those three things, then we will let it go. All right, next slide. So Table Rock Mobile Medicine is a mobile urgent care, and I was joking with Mary that Dispatch Health being here, my competitor, it was kind of awkward, but right now we can't fill our buckets fast enough, so I'm actually sending a lot of patients over to Dispatch Health when we're booked out. So when I'm talking today, I may be joking, but we're kind of all in this together. So what is Table Rock, and why being mobile? So I don't know if you're on that slide yet. So we decided to be a mobile clinic because we had a desire to bill friends and family for their medical questions. So I'm sure if you work in healthcare, you get this all the time over Christmas. And we joked one time that we were going to start a clinic to send my family some of their medical bills. And it kind of blew up, and a lot of friends and family wanted this service, and I didn't even know it was a need. So it was a low startup cost for us, and we were able to reach both urban, suburban, and rural patients, which is kind of a passion of mine, reaching those rural farmers, because that's my family. And then I've always enjoyed the acute and urgent care sides of things. So next slide. So types of services. So we do anything that you would go into a walk-in clinic for. That could be anything from UTI to strep throat to laceration. The picture here is one of our flu shot clinics. So this was last year, where we vaccinated, I think, 20 people in a home for influenza. This year we did about 1,600 flu shots, all in people's homes. Next slide. And then we try to reduce the barrier to accessing healthcare by, people don't like calling and scheduling appointments. They want to do it on their own time. Maybe they want to do it at 2:00 in the morning when you're up with a kid with an ear infection. So we made it really easy. Just do it online. It's a HIPAA compliant scheduling way. Next slide. We try to take almost every major insurance company. So these are a few of the companies we take, and you'll notice here we take Medicaid, Select Health. We're both in the St. Al's and St. Luke's alliances, and we take TRICARE and Medicare and Medicaid. So next slide. So we have to define a service area when you're mobile. When you call to order a pizza, if you're not in their service area, you're not going to get that pizza delivered. And sometimes people will say, well, we're right on the border. can you come to my house? But we're trying to stay on time and not be like a cable delivery or a cable company. So we do stay within our service area, but it's growing and growing every single year. Next slide. So urgent cares are not emergency rooms. So if you're having things like chest pain, shortness of breath, difficulty breathing, you should probably not schedule online with us, and you should go to an ER or Con 911, because sometimes you'll schedule with us like today. We don't have any openings today. We have openings tomorrow, and people, for an ear infection can wait a few hours, but people with they're having a heart attack should not. Next slide. I wish it's still stuck on my screen, so it should say barriers with house calls.
It does. Yeah.
So with house calls, going into people's homes, there's lots of barriers there as well. One is seniors feel preyed upon, and they see house calls as like a too good to be true kind of situation, and they assume it's a scam. Like, why? There's no way that you take our insurance that there's no increased cost. The cost can't be the same as it would be going into a traditional clinic. So a lot of seniors don't use us because of that, and I get it. They are heavily preyed upon. Plus, having a stranger coming into your home can be kind of nerve-wracking, especially for frail individuals. So other barriers is we worry about this one a lot, is bringing in outside pathogens into someone's home. They see that as their safe haven, their kind of sterile environment, and we worry that we're going to be the vector of bringing things in. Insurances don't like new things, so over the past couple years, we've struggled with certain insurance companies, which I will not name here, but some are better than others in terms of approving and credentialing house call companies. So insurances don't like it for various reasons, but that's been a big challenge. And then another barrier is we are not an ambulance service, so we are not a transportation company, and we're not primary care or internal medicine. Training it into an internal medicine clinic in town these days is near impossible. So if you have someone with diabetes, COPD, some severe chronic mental or chronic illnesses, it can be extremely challenging to get these people into primary care. But unfortunately, that's not a service we can provide. There are house call companies out there that do provide some great primary care and internal medicine. So companies like Keystone Health, Doctors House Calls of Idaho, and Care Medical, which is owned by Mary Rawling. Those are some great clinics. So if you have a patient that needs primary care, reach out to those companies, because they have been doing some amazing things. So our nursing philosophy is house calls allow you to see people where and how they live. We can evaluate and treat the whole patient and their family. We can approach the patient as a person and how the disease affects them, their life, and their family. And then we try not to view the patient as the disease or the problem. So that's a kind of a philosophy I always talk with when I have students, is we're not seeing the person, we're not seeing the diabetic, we're not seeing the asthmatic, we're seeing the person with diabetes. How does the diabetes affect them and their life and their family, and how can we get them to a place where they want to be and improve their health? So that's kind of our philosophy, and that's kind of the nursing model. Next slide. So our new normal, people are hesitant to seek care because they don't want to contract things like COVID-19. When they do seek care, they're usually sicker than they were pre-COVID. So they delay, and then they come in when they just can't handle it anymore, and then it's sometimes too late, or they're right on the tipping point. And then since the pandemic's happened, we've seen a variety of places where people actually want their health care. It's not always in that traditional office setting, and people will say pre-pandemic, well, that's gross. Why would I have someone come to my house? My house isn't sterile. Well, you think those clinics are sterile? You're kind of fooling yourself. Now, they do their best, but no place is sterile other than a surgical operating room, and you're not going to get seen for an ear infection in a place like that. But there's no reason why you can't have a visit for a traditional urgent care appointment in places like your house, an RV. I probably wouldn't recommend a converted chicken coop, but we've been there. We've seen people in parks and their garages, and we've even had people that got seen at the Boise airport when they had an emergency landing that was cleared by paramedics. Next slide. We've even seen people at barber shops. So we were attacked online by trying to increase older men's access to healthcare by doing a flu shot clinic at a barber shop. And this is pre-COVID. So the people in the background there, you might recognize as people who are avid anti-vaxxers in town that harass others and actually got arrested at a park. So that was fun. Next slide. So the slide should say case study. He didn't see it coming. So these are going to be a couple of examples of kind of people that we see that may be unique and kind of interesting, but also exemplify the barriers that we try to reduce to increase um, different demographics access to healthcare. So this was a 35-year-old man who is legally blind. He's unable to drive, and his wife works full time as a nurse. The wife called and scheduled for us to go to the home. And when we got there, he had ran into a door frame that he didn't see, and he got a laceration. So we were able to stitch him up. He got to stay home. His wife got to stay at work and continue working as a nurse at the hospital. And he got to continue on his day. So that was one great example of people with disabilities or transportation issues. Next slide. So this one should say a live dive. This was a 35-year-old woman with severe anxiety and depression. So her barriers to accessing healthcare was lack of motivation. She lacked trust with traditional offices. She had struggled with them in the past, and her work hours prevented her from going into a clinic because she worked, 50 to 60 hours a week, and her entire workday was taken up where there was no urgent cares available or primary cares open during the time that she could go. She admitted at a house call that she was having some suicidal thoughts with me. She said I was the first person to ask her if she was having those thoughts and if she had a plan to act on it. And she had seen people before for depression and anxiety, but no one had asked her that question. And she opened up to me and told me that she did. She had a plan to drown herself in Quinn's Pond, which is over um, off of Whitewater Park Boulevard in Boise. And she had a date set. So we got her help, and she started on treatment, and she got into counseling and medication management. And then a year later, this picture was taken, and instead of drowning herself on the date that she had set, a year later, she actually went scuba diving in Quinn's Pond with her husband. Next slide. So we see people with COVID. These pictures were taken at the start of the pandemic, and I was seeing a gentleman in his front yard. He actually was flying to Mexico for his father's funeral when he came down with symptoms, and his son in Boise was hospitalized in the ICU. So instead of going to his father's funeral, he flew back to Boise to be with his son who was in the hospital, but he got too sick to do anything. And when I was seeing him in his front yard, I thought he might have COVID pneumonia and tried to get him things like a chest x-ray. Well, how do you get a chest x-ray on someone with COVID pneumonia in an imaging center that doesn't want to infect their other patrons? So I couldn't find a place that would actually do a chest x-ray. Luckily, Bedside X-ray, the owners that you can see in the picture there, were gracious enough to come to the person's home, and we did a chest x-ray in his garage for pneumonia, for COVID, and we were able to keep him out of the traditional healthcare settings so that he wouldn't infect others. Next slide. So I call this one Stitches with Stuffies because I think she was surrounded by all of her stuffed animals while she was getting stitches in her own bed. Kids are terrified of going into a traditional clinic. There's so much anxiety that's built up from the time you leave the house to the time you actually get seen by a healthcare professional. And so there was so little anxiety with seeing kids in their home that it makes for a completely different experience for the same outcomes. Barriers for this kind of individual was cost, self-pay, and then, they didn't want to have to go into a place like an ER. They received stitches with just, minimal local anesthesia. They got to sit in their comfortable bed, which reduces anxiety, which reduces pain, and they got to avoid things like, sedation in an ER, because sometimes kids get so out of control with that fight or flight response that they cannot be managed. So they have to be sometimes sedated, and that's a huge traumatizing experience for some people. All right, next slide. This one should say case study back on the road. Um, so this was a 60-year-old truck driver lady who called me for back pain. And if you work in healthcare, you're probably already thinking about 20 different differentials or diagnoses that this could be. And she drove an 18-wheeler, so her big barrier was transportation. You think this person's driving a big rig, how could they have a transportation issue? Well, you try pulling that thing into an ER parking lot or an urgent care, and good luck. So I actually met her at the Boise stage stop, and I am I'm 6'7", so I thought those sleeper trucks were a little bit bigger than they are, and they are not as big as you think they are. So that was kind of an interesting experience. But she had dysuria, which is like painful urination, fevers, and back pain. So already I'm thinking of things like, kidney infections, kidney stones, spinal abscesses, and the like. So she refused 911 calls. She refused to go to an ER. And she said, if you don't treat me here, then I'm just going to keep driving. And so I was able to do the best that I could with what I had at the time of the house call. We don't have all these instruments and tools available to us, so we did the best we can. And she was actually able to limp back to her home, and she was immediately hospitalized. And she had an epidural abscess, which is an abscess kind of on her spine. All right, next slide. So we get asked a lot during this pandemic, how can people stay healthy? How can they continue being active when maybe their traditional place or the things that they would do pre-pandemic are no longer available to them, or they don't feel safe there? So one is, get creative with the things that you can do and the things that you have at your disposal. So there are, indoor and outdoor activities that are completely safe. If you maybe used to be a mall walker with a group of friends but don't feel that the indoor setting is safe to you, you can have, an indoor meetup, but still, like a conference call, but still be talking to people, but being active. You can join virtual gyms. You can, I joined the Peloton community during the pandemic, which I think I've worked out now more in the last year than I have in the last 3 years combined, just because I'm now more active, but in my own home. And then also joining like trusted bubbles. So people that that are taking this seriously and doing their part and aren't out being reckless, and you guys only interact with each other, those can be effective as long as everyone's buying in. So it means everyone's wearing masks, everyone's being vaccinated, and staying up on their vaccines, and you only interact with each other. Those are trusted bubbles. Another good way to maintain good health during this pandemic is to open up. So, open up in terms of being open to, mental health issues. So finding a good counselor that you can talk to and trust. There's a lot of telehealth that is now available to people that, for some stupid reason, pre-pandemic was not covered by insurances, or people weren't offering it as a service. So there are those opportunities now. Opening up about your anxieties and fears and concerns with family and friends. So, like, think of with Thanksgiving, Christmas. If you're not comfortable with a situation where maybe an unvaccinated family member is coming into the home for an event, and they're like, "Oh, I just have a cold," you really need to talk openly with those people so that you can express your fears and concerns. Because if you don't tell them what's going on, one, they won't know, but two, that could impact your health. And if you're having issues, especially mental health issues right now, please reach out to people. My cell phone number is always available. The suicide prevention hotline. the mobile crisis unit in the Treasure Valley. Those are great resources. And then, I joke about this, but I gained the COVID-19, as they say, kind of like the freshman 15 when you go to college. But so I think we all put on a little bit of weight, which a lot of it is stress eating. You don't have to necessarily even go out and work for your food anymore. You can have someone bring it directly to your doorstep. And then one strategy I say is don't shop hungry, which means don't go to a grocery store when you're starving. Go after a meal so that you don't buy a lot of things that you don't necessarily need. And same thing with online shopping. It's really easy to get into that habit. Next slide. Another thing you can do to improve your health is getting your vaccines and getting your family their vaccines. So there's kind of four big ones that you should get on a regular basis. One is the COVID vaccine, which is incredibly safe and effective, and preventing things like pain, suffering, and death. That's why we get our vaccines. So pain, think of your shingles outbreaks. Those are incredibly painful, and that causes a lot of suffering, both short and long term. I had shingles in college, and I wouldn't wish it upon my worst enemy. And pneumonia. There's tons of different things in the pneumonia vaccine that decreases your risk of, and just getting 1 to 2 shots can save your family member, save a child or a grandparent, because those are the most vulnerable populations. They're very young and very old, and if we're neglecting to get them their vaccines, then we are putting them at increased risk. Flu shots, it is flu season now. We are actually seeing flu already, even though we didn't see it last year. So the flu affects the under 5 and over 65 and immunocompromised and pregnant. So it's not too late to get yours if you haven't done so already. And, we talk so much about vaccines because they're the greatest invention in human history. You might say, well, fire is the greatest invention. Well, fire is actually not an invention, it's a discovery. So vaccines are the greatest invention in human history because they prevent so much suffering, pain, and death. All right, last slide. So this is my contact information. So if you ever have a question, don't hesitate to reach out to me. I feel like I'm available almost day or night on most platforms: Twitter, Facebook, Instagram, what have you.